Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome to Perspective. And this week we're still remaining in the healthcare space. We're going to be talking hearing loss, and my guest is none other than Zaheera Bham Ismail. No stranger at all to studios and cameras. This is something she dabbles in from time to time. Very well placed to do so. An old colleague, not old as in age, but we've worked together previously, of course, on a similar platform, and that, of course, is the TV space. So it's wonderful to be sharing the platform with her once again. This time around, we're going to be talking, obviously, hearing loss. By profession, Zaheera is a speech language therapist and an audiologist, and as I've said, we're going to talk hearing loss. Assalamu alaikum to you.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you so much, Julie, for having me on your set, and it feels a little odd to be on this side of the seating for a change.
I should imagine that. And, you know, oftentimes when guests come in, they kind of say to me, oh, I'm a little nervous, and I reassure them it's going to be okay. But this time around, I think I'm a little nervous.
No, not at all. I think the biggest hazard with both of us is we never do stop talking. So I do hope it's beneficial, inshallah, for your viewers.
I mean, alhamdulillah, I'm so pleased that you're here. Now, when I look at your title, Zaheera, we are going to focus on hearing loss. Mm-hmm. Something I think people don't take seriously enough, and we'll unpack that in the course of the conversation. But your title reads Speech, Language Therapist and Audiologist. Audiologist, I understand, has to do with hearing. But when we talk about language, what we say speech first, and then it says language therapist. What's the difference?
So just very basically, speech is the way we pronounce sounds, how we put sounds together, the R sound, the S sound, how kids may mispronounce it. And it's got a whole wide variety of other issues that come with that as well. And language is the way we communicate. It doesn't necessarily have to be in a spoken language, like English the way we're speaking. It could be sign language. It could be any other form of communication. But speech and language focuses on facilitating adequate and efficient communication so that the listener understands the speaker in a coherent manner.
Okay, so when we look at hearing loss, my sense is that people just don't take it seriously enough. For example, if you're having problems with your eyes, if you're not seeing as well as you think you used to in the past, you'll get yourself off to an optometrist, get yourself checked out, get glasses, etc. And it's almost like a seamless process. But when we talk hearing loss, I get a sense that it's a disability, if I can. Yes. In fact, is correct to say it's a disability?
So
depending on the
that's it.
percentage of the hearing loss.
Absolutely. And, you know, I think there's been such a stigma around hearing loss. And people see it as part of ageism. They don't actually want to address it. Whereas with glasses, it's really easy because we've seen young people wearing it. We see kids wearing it, adults wearing it. So it's very simple that if you've got an eye problem, put the glasses on. You're able to see. You're able to function. People who don't want glasses can put contact lenses on so you don't always see it. But it's easy to maneuver. You put it on. It works. You're done. Whereas hearing aids first started off with these.
Yeah. Before we get to the hearing aids part, when you talk about the glasses, it's also very trendy to wear very trendy glasses these days. But
But I want to tell you, hearing aids are also trendy, right? Because you can get lots of different colors with it. I think it's a perspective on how we see hearing loss. Hearing loss has always been associated with a disability, has been associated with aging, has been associated with a lot of negative connotations. I have hated how people have called it deaf and dumb, that, oh, you know, people are deaf and dumb. No, they're not. If somebody can't hear, it doesn't mean that any other functions are impaired. They're still able to communicate. They're still able to talk to you. Their mental intellect is not affected by it. They just can't hear you.
However, being the specialist that you are, if you don't address the hearing loss, and we're going to talk about the different phases and the different types of hearing loss and the reasons why, but if you don't address it, would I be correct in thinking that there is a chance of some form of mental disability kicking in?
So actually, research has proven that if you've been found to have a hearing loss and it's untreated, it's left untreated, it actually is a trigger for early onset dementia. And that makes sense because think about it. If you're sitting in a crowded room or in a family environment and you aren't able to hear the person talking to you, you'll say, excuse me, what did you say? I'm sorry, what was that again? You'll ask a few times and then eventually you go, let me rather not ask. And you become quieter and you become more reserved and you pull back and out of all these conversational settings that allow you to be a part of a family. And that has actually shown that it triggers early onset dementia because you become more and more isolated in these settings that you're in.
And that's purely out of embarrassment. You actually marginalize yourself and you don't realize that you're pushing yourself. And of course, I should imagine you become very depressed because you don't feel part of the crowd.
So I've seen patients who have been instrumental in their families, who've got so much of wisdom to share and to impart on people around them. And with not being able to hear or follow the full flow of conversation, they just retreat within themselves. So we don't get to hear what they have to say or those stories again, because it's exactly as you said, how many times are you going to keep asking? People get irritated around you, people get frustrated, and we'll have that conversation in a little bit. But eventually you think, oh, you know what? It's just easier for me to sit by myself. And these days with the phone, it's easier to just pick it up and continue my life in an isolated little bubble. But we don't realize how isolating it becomes for that individual, how quiet that world becomes for them, and how distant they become from the people around them who they really do want to connect with.
So when we look at the issue around hearing loss, it is very definitely a very serious matter. Let's start off by the most important question, and that is how to cope. Where do I begin? What do I start doing? How do I know I'm suffering from hearing loss? And how important is it for me to know the degree of my loss? And you're going to explain to us, when is it a disability? At what percentage of hearing loss am I diagnosed with that tells me and my practitioner that you're now actually a disabled person?
So for me, I see it differently. For me, I see it in terms of how do we capitalize on your abilities? How do we actually make the most of what you have? So that I don't see it, because I always find that if we put that term to it, it's just got a lot more negative connotations.
But it is true, it's there.
So
we can't ignore it.
I do know that without a doubt, government has allowed for people with hearing losses to mark it off as a disability, because we do have patients who come in who've marked it off as a disability on their work forms, and it does give them certain benefits in a working environment for people to have a better understanding of how to interact with them. So you are spot on that. But now let's just start right at the beginning, right? In terms of how do you know there's a problem? So 90% of the time, it's your spouse bringing you in saying they can't hear at all. And we always joke about, is it selective hearing or do they genuinely can't hear? And the partner will sit there and say, you know what, I can hear fine. They just don't know how to talk properly. And it's usually that combination of both. There's always some sort of family history associated with it as well. So when you dig around a little bit, you find out someone in their family had a hearing loss but didn't really do much about it. So it's always this thing of, as I get older, I am going to lose it. I don't need to do anything. So people don't know where to start. They don't know that there are options available that make life functional for them. So they come in and you go, they can't talk. I can hear, but they don't even realize they may be hearing the first part of the word or the last part of the word and just filling in gaps based on what they think they've heard. So for example, close the gate and they heard the date. And they're like, why would you need to close the date? It makes no sense, but I'll listen again and I'll fill in gaps as I need to go along. So what happens is when you come in and you actually get a hearing test done, an audiologist will be able to tell you where your level of functioning is, what sounds you're missing out on, what you may not be hearing, what sounds you may be hearing just the beginning of, the end of, what you may not be able to get anymore. And the problem comes in is that when you leave hearing for too long and it's left untreated for too long, what ends up happening is sometimes your neural pathways will change and it stops hearing those sounds. So even if you aid it after a while, just certain sounds you have to try and learn how to hear again because you've just stopped hearing them. So your brain doesn't recognize those sounds anymore. So it's vitally important that when your spouse is saying you just aren't able to hear me, we need to say, look, actually, let me go and have this seen to. Let me go and have this checked. The way we do our routine health checks every year, the way we go and make sure that we're fine and we're functioning and our eyes are functioning, go and get your hearing test. Because even if it's within normal limits, if there's any slight decline at any point in time, your audiologist will be able to monitor it and will tell you how to optimize your surroundings for better functioning in that.
Okay, let's go for our first ad break. I am talking with Zaheera Bham Ismail. She's a speech language therapist and an audiologist. We're talking hearing loss this morning. Please stay with us. Welcome back. We're talking hearing loss with speech language therapist and audiologist Zaheera Bham Ismail. And you know, if you're one of those fortunate people who doesn't have the problem, I promise you someone in your circle does. Listen closely, please. Excuse the pun. Listen closely and see how you can be supportive to that loved one in your circle. Zaheera, back to you. You spoke about selective hearing where spouses or children might accuse you of being very selective in your hearing. It's not necessarily selective hearing, is it? It's really about the pitch and the tone of voice and sounds that you're making. So you hear part of the conversation and not the rest.
Absolutely.
Please explain that to us.
So, you know, there's an extent that we laugh about, oh, the partner's got selective hearing. So I often do say to my patients with their hearing aids, look, when you're tired of hearing them, just mute the hearing aid and continue as is, because then you can choose not to hear them anymore. But I think we also have to take into account that not everything may be linked directly to a hearing loss, because even normal hearing people will say, excuse me, what did you say? I'm sorry, I missed that. Because sometimes the background noise may be really, really loud. In certain settings, I know I go into restaurants and it's so loud. The music's loud. Other people are talking. You can hear dishes. Just to focus on a conversation in front of you is really difficult. I have to often watch the person's lips. I have to try and figure out what the topic was, because it is a difficult setting generally. Same thing with weddings or sports events, things like that. So when you go, excuse me, it doesn't mean there's a hearing loss. It's just normal that we struggle sometimes in certain environments. The way certain people speak, you'll sometimes struggle to hear them. Some people don't necessarily open their mouth widely. They like mumble their way through it, so it's really difficult to follow that conversation. So you've got to pay a little bit more attention. Also understand that if you are fatigued, you are going to struggle. And I say this to patients also with hearing aids. If you're not getting a good night's sleep and you are fatigued, just hearing takes so much out of you. You will feel exhausted by the end of those conversations. Also, in the same thing is if you are fatigued, you've got a whole lot of stress, you're running through a million things, you come into an environment, there's a lot of noise, background sounds, people are not speaking clearly, you've got to follow a number of conversations, you will leave that place with a headache, feeling exhausted, feeling like I'm so tired of even going out, I don't want to be in public anymore, I don't want to be mixing with people anymore, it's just exhausting for me. But you start realizing that if we start sorting out one or two things on its own, it changes those social environments of how we're able to interact.
Okay, so I know there are different types and reasons for hearing loss.
Yes.
The one thing I also want to touch on is tinnitus. Would that be one of the signs and symptoms at any point in your life that you're heading for a problem regarding your hearing?
So, two things that you have to look out for.
And just explain what is tinnitus.
Yes, for sure. So, two things that we generally look out for, and we usually say, if you have this, just go and get your hearing tested, because we want to see, is it associated with a hearing loss or is it an independent problem that we need to treat? So as you rightly mentioned, tinnitus and vertigo. So vertigo is dizziness, but not dizziness that you feel like you're falling down or linked to low blood pressure. You know, sometimes we get up a little bit faster and you feel a little woozy. Vertigo is that true rotatory vertigo where things are spinning around you, and that's really debilitating. The balance centers are on the inside of the ear, so you should be getting the hearing checked to see, is it associated with a hearing loss or is it something separate that's going on that your ENT can treat and manage for you. The other thing is the tinnitus. Now, tinnitus is like this ringing in your ear, and this is so debilitating because nobody else around you can hear it. But you've got this constant ringing in your ear to the point that it actually affects how you function. It's so frustrating. You almost want to just take your ear and throw it away. It's so bad. So the ringing in the ear can be in the middle ear, it can be in the inner ear, it can be linked to eustachian tubes, it can be linked to a number of things, which is why you do need to get your hearing tested, because the main thing is it is linked on the inside of the ear and the inner hair cells. So a very simple thing is, I'll give you an example, because sometimes people want to know, what does that sound like? And I say that, when you go into an environment with this very loud noise, and you come out and you can still hear that ringing, that tree in your ear, the hair cells are moving. And then you keep exposing yourselves to these loud sounds and you keep coming out of them, and then it just continues moving, and then it doesn't stop moving, and that sound is continuously there. So exposure to noise will cause this. Damage to your inner hair cells will cause this. It can be associated and linked to your hearing losses. So, and my patients hate when I say this, the best thing you can do is to ignore it. So when you hear it, you have to actually trick your brain not to hear it, because the more you hear it and you focus on it, your brain thinks, oh, the sound is supposed to be here. And it kind of makes it louder. So it stays there. So you almost have to trick your brain not to hear that ringing in your ears so that it goes down and it goes softer. So simple things. If you are in a busy environment, I have patients say to me, when I'm out in my day, I don't hear it. But when I come home and I want to relax, that's when I hear it. And that's exactly when you're going to hear it. Because when you're in your normal day environment...
Are you saying it's going on all the time and you're just not aware of it?
And you're just not aware of it. So now you're tricking your brain not to hear it. So certain hearing aids will have programs in it to try and compete with the noise and then lower it. Some patients who have hearing aids, because it's focused on the outside sounds, they don't generally hear it until they take it off. When you're in a busy environment, you'll pick up other sounds, so you're not generally hearing it. But when you're at home and it's quiet and you're sitting, all of a sudden it's loud. So before we used to tell people, switch on some white noise in the background. But now it's a little bit easier. You've got your phone, you've got other sounds around you. You can listen to a water feature outside your bedroom. Just something that your brain can focus externally so it quietens down internally. So if you have a spouse in your home, ask them to keep something on so by the time you've fallen asleep, they can switch it off.
So let me ask you this important question, Zaheera. If you're noticing it more and more often, I have a friend who uses a hearing aid and she's indicated that she's now that much more aware of the tinnitus. What else is that indicative of regarding a medical problem?
So I would first also look at what is going on. First, have a look at what the hearing test is. Has it indicated any need for any further testing, any further scans? But also, what are stress levels like? Because you've got to take into account a person's environment. If they're very stressed out, they're going to hear it more. So when they're in environments where if there's a lot of caffeine, if the environments are not generally a calmer environment, this thing gets louder. So, they often say, you have to do meditation. I say to my patients, you've got it 5 times a day. When you're making salah, be focused. So in easier ways, because when we're in salah, we're so busy trying to run through checklists. I've got to get this done. I've got to get this. I better finish quickly. I've got this much time. And we don't actually focus in that. So this thing is going to carry on. An easy way around it, and I say this to my Muslim patients, is find 1 or 2 meanings in the salah. When you're reading, focus on what those meanings are. Focus on what it means when you are bowing down, when you're in ruku, when you're in sajda. Focus on the meaning of a surah. Focus on the meaning of alhamdu. Your brain is so focused there, it'll take away from this. And you need to put yourself in a state of calm and resetting, which we get 5 times a day.
Subhanallah. So, Zaheera, what you're indicating now is if a person is becoming that much more aware of the tinnitus, then they need further investigation by an ENT.
So ENT and audiologist, the combination of it, those are things you don't want to leave. The vertigo, the tinnitus, any kind of thing going on inside your ears, don't leave it until it's too late. Go and have a look at it. It may be something simple that you can sort out and fix. So you asked earlier about the different types of hearing losses. Just very quickly, you get middle ear hearing losses, inner ear hearing losses, and a mixture of the two. A middle ear hearing loss is near your eardrum and just behind, those are amenable to be fixed by ENTs, whether it's in surgery, whether it's by medication, but you can fix those things. Inner ear hearing loss is permanent damage that's done.
And why do certain people have that? Would it be due to an accident?
The inner ear hearing loss? Aging, family history, genetics, trauma to the ears, noise exposure, medication. Some of the ototoxic medications, chemo medications give you side effects of hearing losses. So there's a number of reasons, but that's part of your investigation. And especially if there's tinnitus and vertigo part of it as well, you have to investigate to make sure you're not looking at something a little bit more serious, that it's just a hearing loss and we treat it there.
Okay, so now somebody decides this tinnitus, would that be the first indication that there's something going on?
Not necessarily. So first indication is you generally struggle with hearing. You generally struggle with someone saying, but didn't you hear that person saying this? No, that's not what I'm asking you. I'm asking you this. Generally, listen to your family saying, I think you need to have it tested. They're not always being funny about it. Just generally go for a baseline hearing test. Once you've got the baseline hearing test and you're monitoring it on a yearly basis, a lot of companies do health and wellness checks for their employees. Hearing should be included in that, and then you just take it from there. And especially if you're working in noisy environments, baseline hearing tests should be a thing that you do regardless.
We're going for an ad break, but let me also just mention very quickly, is like we go for our annual general checkups, I think hearing tests should become a part of that as well. Hearing and sight, of course, but much more about that after the ad break. My guest is Zaheera Bham Ismail. We're talking hearing loss and what can be done about it. And I know because she's an audiologist, she's going to say test, 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 and possibly hearing aids, because if you don't go the hearing aid route, then you're going to be losing your hearing totally, and there's a possibility of dementia setting in as well. Stay with us. Welcome back. We're talking hearing loss with speech language therapist and audiologist Zaheera Bham Ismail. She's based in Johannesburg, and of course she's been in the game for a long, long time. And if you are in the area and you believe you need a hearing test, that's your go-to person. I'm smiling about this, but it is really a very serious matter. And people feel very daunted by the fact that they need to go for a hearing test. I'm kind of wondering, what is the fear that they're going through, and why do they resist going for a hearing test with the possibility of being fitted out with a hearing aid?
Again, I think it's all this negative stigma around it. They're worried about what that thing's going to look like. People are going to see it. And I must say to you, even women with hijab, when it's covered, are worried about what it's going to look like.
Oh,
how are people going to notice it? What will people think about me if they see me with the hearing aid on? And also, you know, I have patients who've been fitted with hearing aids that are left in a cupboard for months on end because they just can't bring themselves to putting it on. I think it's not as simple as glasses. You've got to know how to put it on properly, how to manage putting it into the ear, looking after it, taking care of it, making sure it's going for maintenance on a regular basis, making sure it's not occluded with wax. Sometimes all of that seems so overwhelming that patients go, actually, I'd rather not. It's just too much. And now with technology changing, hearing aids are not managed by remote control. You can get it, but very easily on a cell phone, where it makes it easier to change programs, to change volumes, to make the most of your hearing aids and the features around the hearing aids. But for some patients, it's just too much. And I think you have to take into account that it's a huge step for many patients. It's an acknowledgement of a difficulty they're having. It's an acknowledgement of saying, you know what, you're at this point now where you need extra assistance, and people worry about ageism terribly, especially because social media makes us think we're all supposed to be young all the time. This is something that is not in our control. But what is in our control is how much we can fix and how much we can help the person so that they're functioning optimally. And I keep saying to patients, it's not about saying, oh, I'm so old, I don't need anything. It's about what is the quality of life you want. Do you still want to hear your grandchildren? Do you want to be able to talk to them? Do you want to be able to have a conversation with family? Do you want to be able to be part of things around you? Do you want to hear the lectures at the mosque?
So it's really about your quality of life.
That's
so even if you've just got 5 years left to live, the quality of your
That's
life will
it.
be so beautifully enhanced. But having said that, Zaheera, this is now, we're talking about hearing loss in older people, your matured society. Why do we have children with hearing loss? I should imagine there's a number of reasons. And how difficult, is it more difficult working with children, assessing them and fitting them out with hearing aids, or is it more difficult with older people?
So I think it's, it's a very personal thing in terms of the kind of work that you enjoy. So just coming back to children, again, could be a number of reasons. Children could be born with hearing loss. There could have been some sort of infection. It varies a lot in terms of what they're exposed to as well. But the most common thing that we do find in children is middle ear problems. So simple, let's just start from the beginning. The way we feed babies. So it's amazing how nature works, because breastfeeding, you're holding a baby at a very particular angle, which means that the eustachian tube is at a different angle compared to mine and yours in babies. But holding babies at this angle, the milk is going in the right way and in down the throat.
Wow.
Whereas sometimes mums are busy. So no guilt on mums. Sometimes people are really busy. So they give babies bottles to drink, but babies are flying down flat. And the eustachian tube then goes at a different angle. The milk is trickling down into the ear and then starts forming these infections, right? That's one thing. Kids in primary school pick up infections from each other, pass it on, you bring it home, other babies around you have the same thing. At any given time in a primary school environment, 48% of children will have a middle ear problem. Now, what that means is if I'm talking to you, it sounds like if you press your hands very, very tightly against your ears, if your viewers can do that and press their hands tightly against their ears, you can hear what someone is saying, but it's so echoey and far away, so you don't really pay attention. So you'll get a remark from the teacher saying, child just doesn't listen, is disruptive in class, has a concentration issue, moves from one activity to the next, is unable to complete things. You'll tell your child, please can you go and get your jacket and your shoes? Child will hear jacket and heard nothing else. So those are things you need to say, oh, you know what? I better go and have my child's hearing tested. And it's so important, and we've been pushing for this, that schools put a general hearing screening as part of their annual program. Because some children will complain of pain, some children will have a redness around the ear, some will have a tugging and a pulling at the ear, and others just won't complain. And I promise you, it's so easy to miss. I'm an audiologist, my husband's an ENT, and we've missed it in our daughter. So look out for the things where they're saying, child's not picking up language. If a child's become quieter, babbling babies have become quieter, go and have hearing checked. Child is disruptive, not paying attention, looks like they have concentration issues. Always check eyes and ears as a standard before you decide you're putting them on heavy medication for anything else. If eyes and ears are fine, by all means, then go and look for something else.
So in the case of children who are diagnosed with a hearing problem, and let's assume the child needs to be fitted out with a hearing aid, and we're going to come to hearing aids in a minute or two, does it also mean that at that point in a child's life that speech therapy would also have to play a role? Because if they're not hearing properly, they're not going to know how to formulate sounds.
So you spot on that. So how we learn language is we rely on frequency feedback. So when children are babbling, they listen to you, and it almost sounds like they're mimicking and imitating what you're saying. So we use this motherese language and we go, hello, my baby, and you hear, blah, 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 blah. So you've got this babbling coming back. So children rely on that. If they're not hearing that, you'll notice babbling slows down. So you need to have a look at what's going on. So there's two parts. Let's just look at it. If it's a child who's got a congenital hearing loss, a permanent hearing loss, an inner ear hearing loss that we can't do anything about, that becomes a separate discussion of, are we putting hearing aids on? Is the child entering a deaf world and a deaf culture where they learn sign language? And it's a very proud community, and something that you shouldn't just say, oh, we don't want to know about it. There's so much to learn about it. So that's one aspect. But now we're talking about this aspect of the middle ear problems that is most common in young children. Now, the middle ear problem is amenable to ENT intervention, where they will treat the child. If it's recurrent, they may say to you, your child needs grommets. Grommets does not stop ear infections. All it does is it lets the fluid out of the ear, and it allows for the child to be able to hear better. And we always say to parents, that's the time you also want to then build up and fix up on speech and language therapy. So then you've got children mispronouncing sounds, auditory processing issues, we've got language issues. But those are times when ears are now open, the child will say, oh my goodness, everything is too loud. You start realizing, okay, now the child is able to hear how they're meant to hear. And then you start capitalizing on putting in the right speech and language therapy adequate for that child to make sure they catch up to where they're supposed to be functioning.
And if you don't do that, if that intervention's not in place, that child's going to lose out a lot academically. He or she is going to be lagging behind because they're not hearing. And if you don't hear, you can't process, understand and process. So you're really cheating the child out of a very big part of his academic growth.
And hearing is one aspect. And then we've got auditory processing, which means you can hear, but you just can't always process what's being said to you adequately. And children compensate well. They find ways to make you feel like, oh, you know what, I've got this. And no, there isn't really a problem with my child, but always trust your gut instinct. If your gut is saying to you, something's not right, even though everybody else is saying to you, everything's fine, go and have it checked out. Because something about a mum's gut instinct is always, always spot on. Same way I say to mums, if everyone's telling you something's wrong and you can say, actually, no, I know it's fine because I'm seeing this, and you're honest about what you're seeing, trust your gut instinct. But what happens is children compensate well. But where we're finding a hassle is bigger classroom environments. Teachers may miss a lot because there's so many children in their class. They can't always pay attention. They assume the child will be there. Come end of the year, a report is given to parents. Parents are angry, saying, why are you only telling me this now at the end of the year? And then there's this rush for a quick catch-up, and you cannot do it as a quick catch-up. You cannot come in for 2 sessions, get a report saying, child's well, move them to the next standard. And that's what we see year after year after year. And then especially that transition from primary school to high school, and now all of a sudden, all these difficulties are evident. And children really then struggle. So you're absolutely right. Intervention at an early age is imperative. And if teachers understand this with hearing screenings and what comes with it, they'll be able to give that best information to the parents and to the children.
So Zaheera, depending on the child, the severity of the child's hearing loss, and you also spoke about the different types of hearing loss, the child then needs to be fitted out with a hearing aid. Let's assume the child is 6 or 8 years old. Does that then indicate that his hearing is going to be declining progressively over the years, and every 2 or 3 years a new hearing aid will have to be prescribed for the child? And I mean, that is concerning for the parent.
Yeah, so not necessarily. So with those, especially for children, it's always fitted as a team, never isolated. It's always fitted with direction and support from the ENT.
Okay, can I ask you to hold that thought? Let's go for our next ad break, and we'll be back in a minute or two. We're talking hearing loss not only in adults, not only necessarily age-related, but we're also focusing on children and hearing loss. We've got one more segment to go, so please stay with us. Zaheera obviously is going to share some very important information. Welcome back, and we're into the final segment of our interview today with Zaheera Bham Ismail. She's a speech language therapist and audiologist. A very important discussion regarding hearing loss, not only in the elderly, but in children as well, and how it can impact their lives going forward. Back to you, Zaheera, and we're talking about the children and hearing aids.
I don't think you can say that hearing for every child will decrease as the years pass. This is why it's so important that you have to monitor on a yearly basis to see where the thresholds are and what are we looking at. And like I mentioned earlier, with children especially, it's not fitted in isolation. It's always as a team with your ENT, because if there are things that they can sort out, they will. But it's very important that it's monitored, and then we cope and do the best that we can for children. You asked earlier which is more difficult. For me, I do think it's more difficult to fit with children, because if they aren't always able to tell you, I'm not hearing so nicely, this sounds a little bit louder, that sounds not so good, it's difficult to adjust it. So you kind of do the best you can based on the feedback they give you. Whereas with adults, they'll say, oh, you know what, but the wind when I'm driving is a little bit too loud, and I don't like the sound of the dishes, that's a little bit too loud. But we've got young kids who've got chronic middle ear problems that they just can't keep operating on and taking into surgery. So it's not a permanent hearing loss, but you worry that untreated middle ear problems can cause a permanent hearing loss. But these are middle ear problems that are treated by an ENT, but they can't keep taking the kids in for surgery. So the ENTs have said to us, put a hearing aid on, and we've seen a remarkable difference in a school environment in terms of what they're able to get so that they're not missing out on information. But it is consistent and regular monitoring on an annual basis.
Okay, we want to talk now about ethics, audiologists, and when you get fitted out for hearing aids, that's really very, very important. But just before we get there, in a previous conversation that I had with you, we spoke about bilateral and unilateral hearing loss. Why does that happen? If you are suffering or, if you are losing your hearing, shouldn't it be in both ears?
So generally most common is in both ears, and usually very symmetrical hearing losses. So there's a very small difference between the two ears if there is one, and we go, right, we can manage that. But the moment we see gaps between the hearing losses in perhaps the right ear and the left ear, and then we see that we may only have a hearing loss in one ear, we always have to refer back. The gold standard is to send the patient for an MRI. The ENT then takes that forward and investigates it, because you want to make sure that you're not missing anything more serious like a neuroma or anything at the back on the nerves behind the ear. And those are the things when gold standards of MRI always come into place before you decide which way you're going.
Okay, hearing aids, another very daunting experience for the patient, because there's an array, there are so many models out there on the market, and one never knows, is this the right fit for me? Fit as in, is it going to suit me?
Absolutely.
And then there's also the cost factors to be taken into account.
So hearing aids for me are just a lot more than just cost, and let me explain why. Hearing aids can vary from entry-level hearing aids to top of the market, and the pricing on it is just as extreme. Not all medical aids will cover it. Some medical aids will cover a portion of it. Other medical aids will say to you, look, I'm sorry, we're not covering any of that. It comes out of your medical savings. So it's very important for us to find that out as well. And then how often are your medical aids also allowing a new hearing aid? So I often say to patients, you've got to be able to be fitted with a hearing aid that's got a receiver that gives you ample space so that as your hearing decreases, you don't need a new hearing aid. You just readjust that current hearing aid to make it functional for you. Now, when we talk about, do you just decide on a hearing aid based on a look or on a price? Some people look...
Can I interrupt you here?
Yeah.
You mentioned something very important just now. You spoke about entry level
Yes.
to high end. What if, and let's talk about affordability here. What if a person can only afford entry level? What sort of quality are they going to get from an entry level hearing aid? Is it going to compromise them further?
So the technology on hearing aids these days is phenomenal, regardless of which end you're getting. So I think it ties into your question on the ethics of it as well. So take into account the patient's lifestyle. What kind of environment are they in? If the patient is at home all the time, it's just two of them at home, are you going to ethically sell that patient a high-end hearing aid? The likelihood is they're not going to use 3/4 of the features on those hearing aids. They can get by on something simpler that fits into their budget, that would be functional and work it out. Whereas if you've got a businessman or a businesswoman who comes in and she's got a fast racing job, she needs to be in meetings all the time, she will need the features on those high-end hearing aids because it's going to work just as fast for her as she needs it to be compared to an entry-level hearing aid. So you've got to take into account, and the truth of it is, you have to take into account what a patient can afford. Because as much as we say, oh, it's not important, it is very important, because you don't want your patient having buyer's remorse at some point in time. They have to be comfortable that I've spent this amount of money, it's working for me, it's doing the best that it can for me. Look at the technology that's being offered. the current technology on hearing aids is phenomenal. So I often stick to 2 companies that I'm generally comfortable with because I know the technology that's in their hearing aids, but I also know the backup service they give my clients. And for me, that's very important because you don't want to keep having to pay all the time, every time something goes wrong with your hearing aids. So when I know, oh, okay, for these 3 years, every time you have an issue, we send it in, we don't get charged, they fix it up, it comes back, and everything is sorted. So it's important to understand that and to know that and to speak to your audiologist about what other costs do I have going forward. Then you also want to understand what kind of technology do you have? What is my hearing aid able to do? And the technology on the hearing aids these days compared to just even 5-10 years ago is phenomenal in terms of what you're able to hear, the quality of the sound. Hearing aids will never give you normal hearing again, but it should give you close to normal hearing to give you optimal functioning. And that's why I always say to you, whether you're starting at an entry level or you're going to a high end, the quality of the hearing aid should be good enough to give the patient a good quality of life. And I think ethics on the part of an audiologist is important. And it comes into play because don't just sell for the sake of making a sale. Do the best by that patient because it could be your mum sitting there or your grandmother sitting there and you'd want the best for them. So also it's important for me, we also have to understand that hearing aids may not work for everyone. Some patients may not get benefit from hearing aids. We know this and we test for it to see will they benefit.
So in that situation, does that mean that that person is then sadly doomed to a life of not hearing any longer? And this is now an elderly patient I'm talking about.
And we try and optimize their situations for them. But if we know they're getting limited amounts, for me, what's important is I always say to my patients, objectively, we'll be able to tell this, but only you can tell subjectively what works for you or not. I can say to you, this hearing aid is amazing, but you'll put it on and you'll say to me, you know what, but the one previously was a little bit better, even though it's a lower one for me. I always say you have to trial the hearing aid out. Give your patients an opportunity to use the hearing aids, to take it home with them. Because in your environment, everything works, right? Murphy's Law, everything will work there. The minute they go home, it may not work as ideally. Their situations, their settings may be different. So don't buy a hearing aid until you've tested it. When you know it works for you, when you've seen the benefit, you'll go, hey, actually, I want this for me. And even if they don't take it then, your patients always come back to you. When they're ready for it, if they know you've been patient with them, if you've been kind and you've been gentle with them on this journey and not forcing down a sale, they'll understand that they trust you enough to come back to you when they're ready for it.
Okay, the all-important question, Zaheera, because we're almost at the end of the show, is the issue around adaptability. Is it as simple as getting the hearing aid, you've been in a trial situation for a week or 2 or a month or 2, then you get your hearing aid and, Bob's your uncle, put in your ear and you're ready to go? Or is it really about trial and error, or does it differ from person to person? Some people, it'll just be absolutely seamless, and for other people, it's going to be trial and error, and they shouldn't lose hope and faith. They just need to keep persevering.
And that's it. It's about the perseverance. Don't just say, this is too difficult for me, I'm done, and put it away. You need to be able to push to hear.
But it's normal to feel that way.
Absolutely.
Overwhelmed.
Absolutely. So I've got patients who've used previous hearing aids. They come in and they're like, no, we don't need more of this. We'll just put it in, and off they go. And they're patients who are very tech savvy and they know exactly how to use it on their phone and they make the most of it. And then they're patients who are new users. And the trial is only one part because they don't have to worry about cleaning it or looking after it or washing it up. They just have to make sure that it puts in the ear, let me see what it sounds like, and we're good to go. Now all of a sudden, there's a whole lot more with it. So it's overwhelming. Have I got it in my ear correctly? Have I got the proper placement? Am I making sure I haven't switched it off by mistake? Am I making sure I'm using the apps? Have I added extra programs? It's a lot. You just have to push and persevere. Also, remember, you're putting a foreign body into your ear. It is abrasive. It is a little bit painful. So you got to make sure you're also gentle with your ears. Give your ears a break when you need to. Take it off at home when you need to. Don't say, Zaheera said, I have to wait for so many hours. I have to wait. Be gentle with yourself. It's a long journey ahead. And the other thing I think it's important before we end that I have to mention, it's also important that family participates in the hearing. Because hearing is not just, I'm putting a hearing aid on, now it should be functional. Make sure that the people you're talking to are seated with good lighting so that you can still rely on lip reading. Make sure that the family is stating the topic of conversation. Oh, we're talking about this one's wedding. We're now talking about this birthday. We're now talking about this funeral. So that it's easy for the patient with the hearing loss to be able to fill in gaps and to go, oh, okay, this is the topic. Right, now I know what I'm talking about. This is the topic. Okay, I know what I'm listening out for. Whereas if you just move the conversation, it's so overwhelming, they're going to be like, actually, I don't want to be part of it. And then it's also important that if the patient, as the patient, don't be afraid to say, sorry, what did you say? Because you can still, you're allowed to ask for that. And don't repeat it in the same way. Rephrase it in a different way because they'll be able to hear it a little bit better.
And believe it or not, we've come to the end of the interview. It's been so informative. Thank you so very much. Allah accept and reward you for just the amazing work you do. And I know it's not just your practice. I know you're involved in lots of upliftment work. So may Allah subhanahu wa ta'ala guide, bless you, and forever watch over you and your loved ones. Thank you indeed.
Shukran.
And there you have it. Everything you ever wanted to know about hearing loss and hearing aids, you've heard it today with me and Zaheera Bham Ismail. Till the next time, as always, Assalamu alaikum and Khuda Hafiz.